Hello students, today we are going to learn an infectious disease called as meningitis. Meningitis is nothing but the inflammation of meninges of the brain due to some infection. Now firstly starting with the meninges. Now what are the meninges? Meninges are the layers of the tissues that separate the skull and brain. And we all know that there are three meninges. So below the skull in this diagram you can see that there is dura mater which is just below the skull, then arachnoid matter and pia mater, and then the brain cells are there. So these meninges are responsible for protection of the brain from the injuries, inflammation as well as infections. Now here in this diagram you can clearly see the different meninges. So this is the skin, this is the skull bone, then just below the skull bone we have the first meningeal layer, that is dural layer, then below that arachnoid layer and subarachnoid space between the pia mater layer and the arachnoid layer, and there comes the brain cells. Now what is meningitis? Meningitis is a notifiable disease and exact incident rate is unknown. But in 2010, 4,20,000 deaths and in 2013, 3,03,000 deaths had been occurred. So it can occur as a complications of other disease and 50% of it is an opportunistic infections. So most of the times it is occurring as a complication of other existing disease, but 50% is an opportunistic infection which is caused due to the different infectious organisms. Now what is the incidence rate in the different types of patients? So in newborn, 20 to 30% of newborns may die from the bacterial meningitis, that is the meningitis caused due to the bacterial infections. This risk is lower in the case of older children, not the newborns. Then again it rises in adulthood. In adults, 66% of these cases emerge without disability. The main problem are deafness and cognitive impairment. So wherein deafness consists of 14% and cognitive impairment consists of 10% of the cases. So here adults are also getting affected due to this meningitis. Now what is the definition of meningitis? So it is coming from the Greek word menings, that is membrane. So inflammation of meninges, that is acute inflammation of meninges, is called as meningitis, and it is caused by several infections including bacteria or viruses. Now how these bacteria and viruses enter into the brain, so causing the infection? So there are several routes. First is through the skull or backbone fractures, through the trauma, due to medical procedures, that is surgery related to the central nervous system, then along the peripheral nerves, that is in the peripheral region of the body, that is hands and legs, blood or the lymphatic system, that is through the infectious organisms coming through the blood and the lymphatic system. Now what are the etiological factors? Etiological factors mainly consist of the several microorganisms which can cross the brain, or that is the meninges of the brain. It consists of bacterial infections, viral infections, fungal infections, inflammatory diseases such as systemic lupus erythematosus, that is SLE, sometimes due to cancer also, and due to spine or head injury, that is the trauma. So these are the different etiological factors which lead to the meningitis or inflammation of meninges. Now coming on to the pathophysiology. So how this meningitis occurs? So as we all know that meningitis is due to any of the microbial infections. So for example, if bacteria enters into the bloodstream during the trauma or any other kind of surgical process or any route, so when it enters into the bloodstream, it enters the mucosal surface or cavity, then it breaks down through the normal barriers, including that of the blood-brain barrier. So it crosses the blood-brain barrier and proliferates in the CSF. Proliferation means multiplication of the bacterial cells in the CSF. That leads to the inflammation of meninges, and there is increase in the intracranial pressure, that is ICP. The intracranial pressure is the pressure in the blood vessels of the brain. When it increases, then it leads to the inflammation as well as several complications in the brain. So this is the pathophysiology. Next, coming on to the bacterial meningitis. So bacterial meningitis is also known as septic meningitis. So it is an extremely serious infection and requires immediate care. And it can lead to permanent damage to the brain, disability and death. So this is spreading by coughing or sneezing. So if a person is suffering from the bacterial infection and that bacteria gets into the normal person, and through the coughing or sneezing, the droplets can carry the bacteria to the normal person, and that can reach to the meninges. So treatments which are available for the meningitis caused by bacteria are antibiotics, which are specific as per the causative organisms. Now there are different types of causative organisms which can lead to the meningitis. First is Streptococcus pneumoniae, which is causing 30 to 80% of the meningitis. Neisseria meningitis, which is causing 15 to 40% of the cases, and Haemophilus influenza, which is causing 2 to 7% of cases of bacterial meningitis. Next type of meningitis is tubercular meningitis. So the name itself indicates that this kind of meningitis is caused by the Mycobacterium tuberculi. That is a specific type of bacteria called as Mycobacterium. Now, infection with this bacterium begins usually in the lungs. As we all know that the mycobacterial cells are different as compared to the normal bacterial cells, because they consist of a specific wall, mycobacterial wall, and 1 to 2% of the cases of the bacteria travel through the bloodstream. Unlike other type of meningitis, it progresses very slowly and the symptoms are vague kind of symptoms. So this tubercular meningitis is spreading slowly through the blood circulation into the lungs. So it is usually caused by the droplet infections. That is, if a person is having bacterial infection of Mycobacterium tuberculosis and he spreads the droplets, that is by coughing or sneezing, this droplet is spread into the air, and that contaminated air, if it is taken by a normal person, then it leads to the meningeal infections. So droplet infections, it causes the bacteremia, that is the bacteria in the blood. The bacteria enters into the meninges and brain parenchyma and is causing rich focus into the brain. Then this bacteria rupture into the subarachnoid space, that is the bacteria enter into the space between the arachnoid matter and the pia mater. So this further leads to adhesions, vasculitis and encephalitis. Adhesions, that is adhesion to the interpendicular fossa, basal cisterns, these are the different parts of the brain. Adhesion means attachment or sticking to these area. So when it sticks to the basal cisterns, it leads to hydrocephalus. Hydrocephalus, that is accumulation of the fluid into the brain. Then when it attaches, the bacterial infection enters into the interpendicular fossa. The cranial nerve palsies or cerebral palsies, that is a kind of inflammation leading to the convulsions, and stenosis of the carotid artery supplying blood to the brain. Then it also leads to vasculitis. Vasculitis is inflammation of the blood vessels which are reaching to the brain, that is the carotid artery. So it leads to the stroke, especially in the basal ganglia, due to the blockade of internal carotid artery, middle cerebral artery, etc. So in these, the territories of these arteries, cerebral arteries or carotid arteries, vasculitis occurs, and these area are suffering from stroke, and if it is left untreated, that part of the brain becomes dead. Next is encephalitis. The name itself indicates that it is inflammation of encephalon, that is brain, that leads to the cerebral edema, that is accumulation of fluid in the brain, which further increases intracranial pressure, leads to further complications. So this is the pathophysiology related to the tubercular meningitis, which is leading to the meningitis infection, inflammation and increased intracranial pressure. After tubercular meningitis, next type of meningitis is the viral meningitis. So the name itself indicates it is caused due to the virus. So it is also known as aseptic meningitis, more common than the bacterial form and usually is less serious as compared to the bacterial ones. So it is caused due to the viral infection. So it is less likely to have permanent brain damage after the infection resolves. So it is less serious as compared to the bacterial ones. Treatment, so there is no specific treatment available, but they can be treated with the specific antiviral agents. But most of the patients recover completely on their own. That is the self-healing. Now, what are the different viral causative organisms causing viral meningitis? First of them is the enterovirus, second adenovirus, third is arbovirus, measles virus, herpes simplex virus and varicella zoster virus, for example. So all these are the causative viral species which are responsible for the viral meningitis. Now fungal species also are leading to the meningitis. So this type of meningitis after the viral meningitis is called as the fungal meningitis. So the name itself indicates it is caused due to the fungi. But it is much less common as compared to the viral and bacterial kind of infections. So it is rarely seen in the healthy people, but it is more likely to be seen in the persons who are immunocompromised or who are having impaired immune system, so they are prone towards the fungal meningitis. Now the risk factors. Now what are the risk factors? That is, who are suffering from this kind of infections. So those who are having systemic infections, viral respiratory tract infections, those who are using tobacco smoking, the persons who are having impaired immune system or immunocompromised patients, and in the overcrowded areas. So all these people are at high risk who are suffering from all these kind of infections or conditions. Now other risk factors include vaccinations, seasonal factors, that is winter, spring, etc. Some vaccines also can lead to the meningitis, and the meningitis is found more in the case of winter as well as spring season. Now here we finish the etiology, pathophysiology as well as risk factors of the meningitis. The next topic is clinical manifestations of the meningitis. Now here you can see that if in the case of infants, if meningitis occurs, then there is fever with cold hands as well as feet. Then the baby is refusing feed and it leads to vomiting. Then high pitched moaning or cry, dislike of being handled, neck retraction with arching of back, blank and staring expression, child is difficult to wake, lethargic, pale blotchy complexion is there. So these are the signs and symptoms of meningitis in the infants. So in children or adults, what exactly happens? So there is stiff necks first of all. So there is stiff neck, headache is there, fever is there, vomiting, light sensitivity, drowsiness, joint pain as well as fits, that is the convulsions. So these are the signs and symptoms or clinical manifestations in the children as well as adults. Now specific kinds of signs are seen in the children, that is KERIG'S sign, which is severe stiffness of The hamstrings causes an inability to straighten the legs when the hip is flexed to 90 degrees. So this is how it is occurring. Then Brudzinski's sign, that is severe neck stiffness, causes the patient's hip and knees to flex. So this is Brudzinski's neck sign, which is an indication of the meningitis. Assessment and diagnosis. So coming on to the diagnostic measures of the meningitis. First of all, when the patient comes with the complications or with the signs and symptoms of the meningitis, then first of all the physician takes his history, that is medication history, medical history, family history, and any other kind of history. So from that he comes to know that what kind of infection he is exposed to and how he has got the meningitis. Then also he comes to know what kind of signs and symptoms he was suffering from. Then physical assessment. For the signs and symptoms, just now we had seen, that is neck stiffness, leg stiffness, nausea, vomiting, etc. Then when the physician confirms that the signs and symptoms are related to the meningitis, then he immediately goes for the CT scan and MRI, that is computed tomography and the magnetic resonance imaging. From that the things are clear, that is if there is any damage or inflammation or infection to the meninges, and that can conclude that meningeal infection has occurred. Then blood culture and sensitivity, that is from the blood culture we can come to know that which bacterial, viral or fungal agent is responsible for the meningitis. Lumbar puncture can be done so as to remove the CSF or samples. So that CSF sample can be cultured to find out what kind of infectious agent, that is virus, bacteria or fungal agent is present which is leading to the meningitis. So as to find out the microbial agent responsible for the meningitis, we have to go for the blood culture and the lumbar puncture. So here when we go for the lumbar puncture and we remove some amount of CSF and observe it, then we will find the following things which are helpful in the diagnosis of different types of meningitis. So if you see the CSF, then the pressure is normally 5 to 20, in bacterial it is more than 30, viral it is normal or mildly increased, fungal it is not clear. Appearance of CSF is normal in the case of normal CSF. Bacterial infection turbid, viral it is clear, and in fungal it is fibrin web like structure. Protein, amount of protein in the normal CSF is 0.18 to 0.45. In bacterial it is more, infection it is more than 1, in viral it is less than 1, and in fungal it is 0.1 to 0.5. Amount of glucose millimoles per liter present in the normal CSF is 2.5 to 3.5, but if there is any bacterial infection in the CSF, then it is less than 2.2, and in viral it is normal, and fungal it is between 1.6 to 2.5. If we go for the gram staining, then the normal CSF will appear normal, but the bacterial infection related CSF will be showing 60 to 90% positive, while viral also shows the normal staining. Then if we go for glucose CSF serum ratio, then normally it is 0.6, but in bacterial infection it is less than 0.4, and viral it is more than 0.6, fungal it is 0.4. Then the other parameters, they are different in different kinds of bacterial, viral and fungal infections. So 90% of polymorphonuclear leukocytes are present in the bacterial, but the higher amount of monocytes are there in the case of viral, and in fungal also monocytes are seen in the higher amount. So this is about the CSF findings which are helpful in the diagnosis of different types of the meningeal infections, whether bacterial, viral or fungal. Now if the person is left untreated Then the meningeal infections or meningitis can lead to several complications. Now, which are those complications? First is sensory, neural or hearing loss, deafness. Then epilepsy or seizures or fits, memory loss, paralysis or stroke, and learning difficulty. So these are the complications associated with the meningeal infection if it is left untreated. There is also behavioral difficulty or behavioral changes. Intelligence or learning memory is reduced. There is septicemia, that is presence of the bacteria in the blood. And finally, if the septicemia is not cured or if this meningitis is not cured, then it can lead to the death also. Now coming on to the medical management. Now how this meningitis can be cured. So in the case of bacterial meningitis, so third generation cephalosporins are used. Examples of them are cefotoxim and ceftriaxone. Vancomycin is also added in the regime in the case of the person showing resistance towards the cefotoxim and ceftriaxone. Apart from this, some steroidal drugs are also used, for example dexamethasone. Then for seizures or fits, phenytoin can be used. And in the case of dehydration or shock or hypovolemia, it can be treated with the fluid therapy. In the case of tubercular meningitis, several antibiotics or anti-tubercular medications can be used. The anti-tubercular medications include isoniazid, rifampicin, pyrazinamide and streptomycin. Second line anti-tubercular drugs are also used, which are including aminoglycosides and fluoroquinolones. Conventional therapy is given for 6 to 9 months, and in the case of children, BCG vaccine can be given to produce protective effect. For viral meningitis, there are several drugs which can be given. Specific antiviral treatment is not actually given. Treatment is mostly supportive and no medications are prescribed. But if there is seizures or chances of occurrence of the seizures, so prophylactic treatment can be given in that case. That is the treatment which is given before the disease occurs. That is before the seizures occur. So in that case, we give lorazepam or phenytoin or barbiturates, that is the anti-epileptic or anticonvulsant drugs. In the case of increased intracellular pressure, so as to reduce the increased intracranial pressure, we give the mannitol injection 1 gram per kg followed by 0.25 to 0.5 per gram per kg, and or dexamethasone, that is a steroidal agent. Then rest is advised in the case of viral meningitis. The person can be given the medication and recovery is fast. In the case of hydrocephalus, in the case of viral meningitis, that is the accumulation of fluid in the brain, then in that case adequate hydrogen has to be maintained. Antipyretics are to be given to reduce the fever. Antiemetics are to be given for reducing the vomiting. Now complications: seizures, difficulty in children, learning difficulty in children, behavioral difficulty, hemiparesis, that is the paralysis, and death. Assessment: admission history and physical examination, vital signs, ongoing assessment for the disease progression, that is how the disease is progressing. Patient is monitored for life-threatening complications such as respiratory failure. High risk of injury related seizures episodes are monitored. Impaired verbal functions, cranial nerve dysfunction is also monitored. Fear and anxiety, loss of control, paralysis is to be monitored, and potential for secondary complications, that is infection, are to be taken into the consideration. So in the case of nursing, several diagnostic characteristics are there. So in the case of meningitis, if there is ineffective gas exchange, decreased tissue perfusion, impaired physical motility, paralysis, fatigue, pain related to the disease condition, altered nutrition, dysphagia, that is nerve dysfunction, that is taken into the consideration. and treatment is given with the help of antiviral medication or antibiotics in the case of viral and bacterial infections, and steroidal drugs can be used. Sedatives are used for avoiding the restlessness. Acetaminophen or paracetamol is used for the fever, and physical therapy if brain is affected after the infections. Maintaining the respiratory functions associated with the respiratory dysfunction of meningitis. So you have to assess the respiratory rate and quality of the respiration, frequency of the respiration. Perfusion pulse oximetry can be used. Then for monitoring the patient for respiratory insufficiency, and that pulse oximetry can be helpful in this. Then if there is less oxygen supply or respiratory insufficiency is there, then ventilator support or oxygen therapy can be provided. Chest physiotherapy so as to increase the respiratory rate. Elevation of head of the bed so that the lungs are getting relaxed. Monitoring vitals, that is heart rate, blood pressure, etc. Suctioning in the case of accumulation of cough into the respiratory tract. Reducing effects of physical immobility, change the position of the patient too hourly. If the extremities are paralyzed, if hands and legs are paralyzed, then they should be supported. Then exercising should be there too hourly. Use of comfort devices. Adequate nutrition and hydration, use of elastic stocking, massage, hygiene maintenance. Nutritional support can be given by tube feeding, assessment of bowel sounds, check for the weight of the patient, parenteral nutrition can be provided if required. Then bowel sounds are to be checked, and intake and output of the food have to be checked. If the person is suffering from paralysis due to the meningitis, then communication improvement should be done, which includes lip reading, use of picture cards, speech therapy, using pen and paper also. Relieving fear and anxiety, for that the patient's condition is taken into the consideration. Positive appraisal is done, encouraging relaxation exercise and giving positive feedback. Clearing the doubts of the patients, managing pain with the analgesic drugs, and diversion therapy is helpful in this condition. So here we finish the meningitis, that is the etiology, pathophysiology, diagnosis, clinical features, and the treatment of meningitis and nursing care which has to be provided with the treatment for the treatment and cure of the patient. Thank you so much.